Hello, I'm Max Truscott, and this is the YouTube version of my top-ranked Aviation News Talk podcast, a weekly show with news and tips for pilots and student pilots to keep you safe. I'm the author of several books and the 2008 National Flight Instructor of the Year. About 2 weeks ago, I went flying. No, not in one of the airplanes or jets that I teach in, but I took my first commercial airline flight as a passenger in over 6 months. And a lot of people are wondering, is it safe to fly in the airlines? So in this video, I'll share my experiences, and while I'd love to tell you everything was just great, well, parts of it weren't. I will tell you what I learned on the trip and what I'll do differently next time to better protect myself. I'll also pass along the results of an MIT study that attempts to quantify the risk of catching COVID-19 while flying on an airliner. Now, please hit the subscribe button so you don't miss next week's show, and here's our show. And just a warning about this show, I will be talking about face masks and what I used. So if you don't believe in wearing a face mask, you might not want to listen to this show. Please don't waste your time sending me nasty emails about face masks because after all, I did warn you that you might not want to listen to the show. Now let's talk about airline travel. I'll tell you about my trip and then I'll talk about the MIT study. The big question on most people's mind is airline travel safe today? And I think the answer is, it depends. It depends heavily upon the precautions that you take before and during your airline trip. I'll tell you about the precautions I took that made me feel relatively safe, and I'll talk about the big one thing I'll do differently the next time I take an airline trip. First, let me talk about why I took an airline trip. I live in Northern California, which is one of the areas hit hard by COVID-19, so I've been taking a lot of precautions. For the first several months, I stayed mostly at home, which meant I was no longer flying 2 or 3 times a day. I'm a busy flight instructor, and I'm generally sitting shoulder to shoulder with my clients in a small aircraft for a couple hours at a time, and many of these planes have poor ventilation. So not only can we not safely socially distance from each other, but we're also rebreathing the same air. A couple of months ago, I started teaching again, but only in a simulator where most of the time I can stay about 6 feet away from the client. Also, we have better air circulation in the simulator, so it feels safer than sitting side by side in a small airplane. Before the pandemic began, I was doing a lot of teaching in the Cirrus Vision jet, which is the one jet I specialize in because I love it. It's designed with a pilot in mind, is extremely comfortable, and has a huge window with a great view. Plus, the avionics, the G3000, are leading edge, and for a technology wonk like me, they're just fun to master. However, to fly a jet, the FAA requires that every year pilots take a pilot proficiency check, which is essentially the same as taking the original check ride in the jet. And right now, the only way to do that in a Cirrus is to fly back to Knoxville, Tennessee, and spend 2.5 days in a multi-million-dollar simulator. I haven't resumed teaching in smaller planes yet, but I have started teaching again in the SF-50 Vision jet as I can sit a little farther away from my clients and because the Vision jet has better air circulation. My jet currency was due to expire at the end of September, and a local pilot just bought a Vision jet and needed training, so I was motivated to get to Knoxville so that I could remain current and resume teaching in the Vision jet. So I traveled to Knoxville on 1-day notice. Cirrus called me on a Monday telling me they'd had a cancellation and could I be there to start on Wednesday. To do that, I had to leave early the next day, Tuesday, as it takes most of the day to get from California to Knoxville. The first thing I thought about before booking plane tickets was how can I minimize my time on an airliner and in the terminals, as I felt that was where I would be at the greatest risk of exposure to COVID. I knew there were no direct flights from California to Knoxville, but I also remembered there were direct flights from San Francisco to Nashville. From there, I could drive 3 hours to Knoxville in the relative safety of a rental car. That would have limited my exposure to just 1 4-hour plane flight with minimal time in the terminals on each direction. But when I looked for those direct flights, they were gone. So the first thing to know about airline travel these days is that many of the direct flights that were available in the past have been discontinued as the airlines have been shrinking their flight schedules to meet the new lower demand, which is less than 50% of what it was a year ago. I then looked for a Delta flight I've taken in the past, which was very convenient as it departed from the San Jose airport, which is closer to me than SFO. That flight required a short layover in Atlanta and then connected to a regional airliner for a 30 to 40 minute flight to Knoxville. Unfortunately, that flight has also been dropped. So ultimately, I ended up choosing a flight from SFO to Dallas-Fort Worth, which had a 1-hour layover, before connecting with a 2-hour regional airliner flight to Knoxville. And I purposely chose an earlier flight so that if there were a delay getting to Dallas, I might be able to hop on a later flight, which would be the last one going to Knoxville. With the tickets booked, I then thought about how I'd be getting to the airport, and that's where I did something different. Typically, I would use either the Uber or Lyft app to request a driver to take me to the airport. But I really wanted to avoid contact with any drivers, so I decided to drive myself to the airport. In the past, when I've done that, I typically park in a long-term parking lot and then take the bus over to the airport. But just like taking an Uber, the bus would put me in contact with more people, so I chose to park in the short-term parking garage next to the airport. And since I would be gone only a few days, the cost wasn't much more than the round-trip cost of getting an Uber or Lyft driver. Since I was buying airline tickets just one day in advance, the tickets were relatively expensive. And so the cost difference between economy and first class wasn't that great. So I booked first class tickets, figuring I would be seated slightly farther away from other people and that I'd spend less total time on the plane as I would be one of the first people off the plane. In preparation for the flight, I pulled out my only 2KN35 mask. These are my best masks, which I rarely wear, and I save them for the most risky situations. My family, which includes one healthcare professional, strongly encouraged me to not take my mask off at all when on the airplane or in the terminal, and that meant no eating or drinking on the plane or in the terminal. Now that seemed like it might be a big challenge, but I succeeded in doing it, and I'll tell you how in a minute. I also refilled my bottle of hand sanitizer, which I used a lot during the trip, and I also brought a large package of wipes that my wife provided me, and these are the one thing I didn't use on the entire trip. They came back with me unopened. My final piece of equipment was a set of safety goggles, which sealed tightly on my face for eye protection. There are anecdotal reports of COVID-19 transmission through the eyes, specifically of healthcare workers who wore masks and appropriate PPE, but no eye protection, and somehow contracted COVID-19. So it's still unclear whether you can catch it through your eyes, and I didn't wear the goggles all the time, but I'll tell you when I did, and when I was very glad to have them. I purposely brought just carry-on luggage for this trip as I wanted to avoid standing in any crowd that might be around the baggage carousels when I reached my destinations. As I drove to SFO on Tuesday morning, I finished the Starbucks chai tea I'd purchased the night before, and I downed a large bottle of water. Now, my family said, don't take my mask off, but they didn't say don't use the restroom. So I planned on drinking plenty before the flight and nothing during the flight. Arriving at the airport SFO, the terminal was more deserted than I think I've ever seen it. And here's where having TSA's pre-check, known as pre, really was a benefit. In the regular TSA line, people were all bunched up next to each other, though they were all wearing masks. By contrast, the pre-line was empty and I sailed right through the line. One big difference is that the TSA officer was behind plexiglass, and for the first time ever, he didn't ask for a boarding pass. Instead, he asked me to insert my driver license into a scanner located on my side of the plexiglass. He then asked me to remove my face mask briefly so he could confirm that I looked like the person in the photograph, which must have come up on a computer terminal he was looking at after I scanned my driver license. My guess is the computer also had a link to the airlines, confirming that I had a valid boarding pass issued in my name. The carry-on luggage scanner was new. It had a feeder that automatically served up one really large container at a time. I'm guessing that the containers were automatically cleaned by the system after each use before being recycled automatically to the front of the line. At SFO, everything had to go into a container, even my carry-on bag, which normally I would just put directly on the conveyor belt. After my backpack and carry-on bag went through the scanner, they split out onto two separate conveyor belt lines, one of which I could reach and the other which could only be accessed by security personnel. Now, I don't recall what caught their interest this time, but most of the time my large collection of wires and electrical gadgets gets their attention. In this case, I think I remember it was that large package of wipes, which probably looked like a large solid liquid. As I exited the security area, I overheard an airline crew talking about how nice the setup was at SFO, and by that I think they meant that it appeared well designed to minimize the spread of COVID. And I agree, so far the experience felt very safe. At the gate, I was one of the first people to board. Once I was in my seat, I pulled out my goggles and put them on as the rest of the plane boarded. While it may have looked funny, I wasn't the only one who brought eye protection and thought it was important. During the trip, I saw at least a half a dozen other people who were wearing various kinds of special eye protection. As I waited for the rest of the plane to board, I started to realize what a great combination the KN95 mask and the goggles make. I used to always wear a cloth mask. This is one here from Chartedall that I liked a lot. But eventually, the cloth would become wet from my breath, and then it became slightly annoying to have a wet cloth continually on my lips. By contrast, the KN95 has a large void around your mouth and nose, so the mask doesn't touch my lips, which feels much better. Plus, the KN95s have a much better seal, and you can tell that when you breathe in sharply, as the mask will suck in against your face if you have a good seal. And to get a good seal, I shaved that morning, and I bent that metal piece at the top of the mask so that it fit well around the bridge of my nose. But what really sealed the mask even better was having the goggles on. The bottom edge of the goggles pushed down on the top of the mask, giving the mask an even tighter seal. And surprisingly, I was really quite comfortable, and there were times on that first 4-hour flight that I actually forgot that I was wearing a mask and goggles. After we boarded the plane, some of the in-cabin announcements were different. For example, we were told there would be no meal and drink service to minimize the contact between flight attendants and passengers. They also announced that passengers must wear masks at all times, except when eating or drinking, and if they fail to do that, they might be banned from future flights on that airline. In first class, we were offered a choice of breakfast that came prepackaged. I chose the yogurt and granola, and I saved it and ate it for breakfast the following morning. One thing I didn't worry about when I was on board was wiping down surfaces around me, and I didn't see anyone else wiping down surfaces either. Here's a statement from the CDC about catching COVID-19 from surfaces. It says, based on data from lab studies in COVID-19 and what we know about similar respiratory diseases, it may be possible that a person can get COVID by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. The agency wrote, but this isn't thought to be the main way the virus spreads. So that's probably another benefit of the mask and goggles. Even if I were to have touched a surface with COVID-19 on it, the mask and goggles would prevent me from accidentally touching my mouth, nose, or eyes. While on board, I did go to the restroom a couple of times, but I never once removed my mask or goggles while on the flight. When we arrived at DFW, the flight attendant announced a very different procedure for getting off the plane. We were told that we shouldn't stand up from our seats until the row in front of us had departed the airplane. That made sense, as it seemed like it would reduce the time that people are all packed together in the aisles waiting to get off the flight. But on this particular flight, everyone seemed to stand up at the same time and basically ignore the instruction. However, on some of the other flights during the trip, the flight attendants made this announcement more than once, and indeed people did tend to stay seated until the row in front of them had departed. Now, our flight was delayed into DFW by about 40 minutes because of a storm in the area, but I was feeling very good about how well the trip was going and was ready to recommend to people unequivocally that they should return to flying on the airlines. But that's when the wheels started coming off the bus, and it became, frankly, one of the worst trips I can remember flying on the airlines. My outbound flight to Knoxville was also delayed about 40 minutes, which we were told was because they were waiting for the captain to arrive at an inbound flight that was delayed. Over the next 8 hours, I received 13 text messages from the airlines, each representing either a gate change or a new updated departure time. The gate changed 5 times, and the departure time changed 13 times. The story we got from the gate agent started with a delayed flight crew, then became that the aircraft had a mechanical, and then it became, we're looking for another plane for you. At one point, I overheard a gate agent tell a passenger that she couldn't switch them to the other flight going to Knoxville unless our flight was canceled, which it wasn't. So I didn't inquire right away about asking to get on that flight. When I did finally ask, saying that I was traveling first class and would like to switch to the other flight, the gate agent took my name, looked at the computer, and then said, "I'm sorry, I can't do that because, quote, you don't have status." I took that to mean I don't fly enough on that airline to have achieved any of the frequent flyer tiers that they offer. But frankly, I felt the statement was baffling on 2 levels. First, from a customer support standpoint, telling someone you don't have status is insulting. I didn't take it personally and wasn't insulted, but I did think there were probably 100 better ways to tell someone, "I'm sorry, but I can't help you." Telling them you don't have status is not the way to promote good customer relations, because the word status does have meaning beyond just a frequent reward program. And in the outside world, people like to think that they have status of some kind. So if there's anyone from that airline listening, I'd suggest you tell your gate agents to not tell customers you don't have status when you're unable to help them. But I was also baffled that I'd paid full price for a first-class ticket, but that wasn't good enough to get me switched to another flight. It was particularly ironic as just a few days before, we had reported on the Airplane Geeks podcast that this airline and others announced that they were dropping change fees, which were typically $200 per change. Well, it didn't help me much that they weren't going to charge me a change fee because they wouldn't even let me change flights. Ultimately, my connecting flight was delayed over 8 hours. That flight left a little before 11 p.m. Central Time and arrived in Knoxville a little before 2 a.m. Eastern Time. I was particularly torqued about that as I was planning to use the evening to study and then get to bed early so I'd be in good shape for my simulator training. Instead, I got about 5 hours of sleep before I had to show up and perform. Overall, from the time I put my mask on when I entered the SFO terminal to the time I took it off when I arrived in Knoxville, it took me over 14 hours to get there. As I've mentioned to others, it took me less time than that to get to Australia when I flew there 2 years ago. I did use the 8 hours I was stuck in DFW to go outside, take off my mask, eat the sandwich I brought with me, and drink a small bottle of water. Other than that, I had the mask on for 14 hours straight and the goggles on whenever I was on board the aircraft. And surprisingly, the mask and goggles really were comfortable. What was unpleasant was having to wait 8 hours in Dallas and being told I couldn't switch to a plane that would have gotten me in 7 hours earlier than mine. By the way, mask compliance was excellent for most of the trip to Knoxville. I did notice that by around 9 p.m., about half a dozen people in the waiting area for my second flight had grown weary of waiting and wearing masks and took their mask off, but I wasn't near them and wasn't concerned for my own safety. One nice thing about the outbound trip was that none of the terminals were crowded and I could move around easily and still stay 6 feet or more away from everyone. Now, that was not the case for the return trip, which was vastly different in many ways. And before I tell you about that, let me briefly tell you about the one thing I will do differently the next time I fly, which will probably be in about 2 weeks. And that's regarding the type of mask I use. The Food and Drug Administration's FDA.gov website says, quote, "The CDC recommends that members of the public use simple cloth face coverings when in a public setting to slow the spread of the virus, since this will help people who may have the virus and do not know it from transmitting it to others." That's great, but that seems to say that cloth masks won't protect you from others who might not be wearing a mask or who are wearing it improperly. Now, my understanding is that the KN95, such as this one I was wearing, is very similar to the N95s used by medical personnel, except these are made in China. The big benefit of an N95 respirator, and this comes from the same FDA.gov website, is that, quote, "The edges of the respirator are designed to form a seal around the nose and mouth. I could definitely tell when I sucked in on my KN95 that I had a good seal, and it seems like that tight seal might provide me with more protection than a normal cloth mask from people who aren't wearing masks or who are wearing them improperly, such as having their nose hang out above the mast." But what I discovered after my trip is that the quality of KN95s varies widely. Here's a quote from NPR.org. "Testing has revealed that the actual performance of many of the KN95s for sale in the U.S. is all over the place, and many are counterfeit," said Avalash Kramer, a doctoral candidate at Harvard-MIT Health Sciences and Technology program. And I've read elsewhere that while KN95 should filter 95% of air particles, testing showed that some really bad ones only filtered about 25% of the particles. So while I felt really comfortable and safe while wearing my mask, I had no idea what company had manufactured my mask and whether my mask was performing the way it should. And that was pretty unsettling. So when I got home, I researched KN95s to figure out what to buy for my next trip. Initially, I found it a little difficult to identify which masks were good, and eventually I discovered that the FDA has a website called Appendix A, which lists, quote, "authorized imported non-NIOSH approved respirators manufactured in China, updated September 14th, 2020. Now, NIOSH is the National Institute of Occupational Safety and Health. They test masks made in the U.S., but they don't test masks made in other countries. So if you find a KN95 that says it's NIOSH approved, apparently that's not true, so you may want to avoid those masks. I did find some companies offering masks for sale that showed all kinds of approvals and test results attesting to the quality of their mask, but then I went to Appendix A, and some of those companies were not on the list. By the way, the list is continually changing, so you'll want to go out and look at the Appendix A list when choosing a mask. I finally found a company selling masks that were on the Appendix A list, and I ordered 10 respirators to try them out. So far, they've been fine, and I plan to order more of them in the future. What I really like about them was that they have an anti-fake label on the bag. Basically, you scrape off a coating from the label, which reveals a number. Then you go to that manufacturer's website, enter the number, and it will verify if the mask you received are genuine. I don't know if this is foolproof, but it probably provides a little additional security. I'll include a link in the show notes to the KN95 mask that I bought and a link to the website where you can enter the number and verify if the masks you buy are real. And I'll also include a link to the FDA's Appendix A so you can check out other KN95 mask approvals. And you can find the show notes at aviationnewstalk.com/163. Now let me tell you about my return trip. I departed Knoxville about 2 p.m. on the Friday of Labor Day weekend. And as you can probably guess, there were a lot more people traveling on Friday than they were on Tuesday. Getting through the TSA line at Knoxville was very quick. I entered the pre-check line where there was no one ahead of me, so I again avoided waiting in a line. I put my carry-on luggage on the conveyor belt, but forgot that I left a small bottle of water in my backpack. The screener let me drink the water, but what I realized afterwards was that the screener was holding the top of my bottle when he handed it to me, and then I drank it. He was wearing gloves, but I couldn't help wondering what his hands had touched before he grabbed the top of my water bottle, and I won't make that mistake again. My first flight, the regional airliner, was completely full, but the flight was uneventful. We did arrive about 20 minutes late, which concerned me a little as I had a 1-hour connection in DFW. As we arrived at the gate, the flight attendant instructed people to not stand until the row in front of them had departed, and this time people actually did that. Now, I was happy to be first out the door, though I had to wait in the jetway for my larger carry-on bag to be delivered, as it was too big to fit in the smaller overhead compartments of this regional jet. My bag came quickly, and as I entered the terminal, I noticed it was much more crowded than it was on Tuesday, but it was not totally packed. Now, my second flight was in a different terminal, so I walked up to the SkyTrain, which loops around all of the terminals. When I exited into the other terminal, I was shocked to see it was completely packed. There were people everywhere, and it was not possible to stay 6 feet away from other people at all times. There were long lines at the fast food places, which made me happy I'd had lunch before I left, and I had planned not to eat or drink anything on the plane or on the terminal. I made a quick stop at the restroom and then arrived at my gate, where fortunately boarding had just begun a minute or two after I arrived. That was totally lucky, as I very much wanted to get out of that terminal and onto my aircraft as quickly as possible. After I boarded, I took my seat, put on my goggles. Generally, I only wore the goggles while on board an aircraft, which is when I was the closest to other people. On that flight, I was seated in row 1, so I didn't really have a good view of the other passengers behind me. I did notice that every time I looked at the passenger across the aisle from me, his nose was hanging out above his cloth mask. And when you wear a mask, it's to protect other people, and clearly his mask was doing absolutely nothing to protect me, which is why I was happy to have a tight-fitting mask and goggles. As we got within an hour of San Francisco, I decided to take a selfie while holding the camera high so that it would also capture people sitting in back of me. And when I looked at that photo afterwards, I was shocked. Remember, I was flying on an airline that said if you weren't wearing a mask, you could be denied future flights on this airline. And when I looked, there were 5 faces visible behind me, and get this, only 2 of them had their masks on properly. And of the other 3, the one that completely floored me was the guy sitting 2 rows behind me. He was fast asleep, leaning back in his seat with his mouth wide open as he slept, and there was no mask in sight. But at least we had a great view of his tonsils, which looked pretty good. So if I were a doctor, I probably could have easily removed them. Of the other two people, one didn't have his mask on, and the other person had their mask on looped over one ear, but was holding the other loop in front of their face, so essentially that mask was also off. And it was at that moment I realized that it really does pay to be a little paranoid when you're flying on an airplane, and that it probably pays to take a few additional precautions, especially since not all other passengers will comply with the rules all the time. So here are some of the key takeaways from my flying experience. The airports and the airlines really have done most of what they can do to make airline travel safe. However, you are clearly at greater risk when you're on the airplane than you are when you're in the terminal, as the terminals are generally much less crowded unless you happen to travel on a holiday as I did. Unfortunately, you cannot rely on all passengers to wear their mask at all times, and I think that's when you're at the greatest risk. So rather than wear a cloth mask, which doesn't do much to protect you, I'd recommend wearing a KN95 mask, as it seals better than the cloth mask, which may give you some additional protection against people who aren't wearing their mask properly. Plus, to me, the KN95s are just more comfortable, and I've now stopped using my cloth mask altogether, and I use the KN95s anytime I'm wearing a mask. Now let me tell you about the MIT study. That study used data and research to approximate the probability that an air traveler in coach, in economy, will contract COVID-19 on a U.S. domestic flight that's 2 hours long, both when all coach seats are full and when all but middle seats are full. Their estimate, which was based on data from late June 2020, is that on a completely full flight, you have about a 1 in 4,300 chance of catching COVID-19 on a 2-hour flight. But if the middle seats are empty on your flight, then you have only a 1 in 7,700 chance of catching COVID-19 on a 2-hour flight. In my case, I was on the airlines for a total of about 12 hours, which is 6 times longer than the 2 hours used in the study. I was also in the terminals for over 9 hours, and this study doesn't estimate that risk. So since most of my flights were full, to estimate my chance of catching COVID on this entire trip, I need to divide 4,300 by 6, which yields 716. So that suggests I had a 1 in 716 chance of catching COVID on my round trip to and from Knoxville. And how do I feel about that? Well, I'd like to think my chances of catching COVID on my commercial flight were less than that, since I wore a pretty good mask, better than the cloth mask, and because I never had to take it off because I didn't eat or drink on the flight. But I also think there are so many factors involved that it's hard to know the exact risk on any given flight. But I will tell you this. I am planning to take another commercial flight again in a couple weeks, as I need to fly a customer in his Vision jet to Knoxville so he can do his type rating training with Cirrus. And then the following day, I'll need to fly the airlines to get back to San Francisco. So even though there is some risk of catching COVID on the airlines, that risk feels low enough that I'm willing to continue flying on the airlines when I want to. Of course, that doesn't mean that flying the airlines is in general a fun experience. It's just not like it used to be many years ago. But I will tell you this about my trip. It just felt great to get out of my house and do something I wanted to do, which was to get my annual jet recurrent training done. And getting back on the road and doing my jet training felt like it brought back just a tiny bit of normalcy back into my life, and I'm truly grateful for that. Because these are frankly crazy times, and I think we all need to find some ways to find some semblance of normalcy and do some of the things that we enjoy. So if you do want to fly somewhere in the airlines, I suggest you go and do it. But please do take some precautions as I did. Don't just throw caution to the wind, as we are still in the middle of a pandemic. And before we sign off today, I'd like to share an email from a listener. Tim Crawford wrote, "I really appreciate all the amazing content you put out on the Aviation News Talk podcast. It has kept me inspired and educated over the past year while working toward my pilot certificate. I can only imagine how much work goes into preparing, recording, and editing these podcasts, along with all your other obligations. Thank you for sharing your knowledge with the community." And Tim then signed up to support the show via Patreon. So if what Tim said resonates with you and you feel like you're getting a lot out of the show, I would greatly appreciate it if you'd sign up to donate a few dollars each month via credit card. And when you do, no matter how much you donate, I'll read your name on a future show, which means that people in over 140 countries, including places like Trinidad and Tobago, Ghana, and Bolivia, will hear your name. And how cool is that? There are 2 ways to donate. One is via PayPal, which lets you sign up for either a monthly donation or a one-time donation if you'd like to donate a lump sum. And you don't have to have a PayPal account to do that. Just go out on the web to aviationnewstalk.com/PayPal, enter a dollar amount in your credit card. And of course, you can just click on the link in our show notes to get to aviationnewstalk.com/PayPal, and you can get to the show notes by swiping in whatever app that you're listening to us now. You can also donate to the show monthly via Patreon. And when you do, you can get all kinds of goodies at the various contribution levels, and those are listed on the website. To donate via Patreon, just go to aviationnewstalk.com/awesome, because you are all awesome listeners. And as I mentioned at the beginning of the show, we have about 360 supporters, and I'd like to ask you to donate now to help us with our goal of hitting 400 supporters before the end of the year. So until next time, fly safely, have fun, and keep the blue side up.